Coronary artery disease is when the arteries that feed your heart become narrow or blocked. The main reason, atherosclerosis. That is when plaque builds up in those arteries. As the artery gets smaller, the heart gets less oxygen, causing ischemia. Basically, your heart saying, I can't breathe. If a blockage becomes complete or successful, this leads to infarction, better known as a heart attack. So CAD is basically the heart starving for oxygen.
Alright, so I'm going to talk about a really important topic in cardiovascular health. It's called arteriosclerosis. This is how the heart actually tries to protect itself through something called collateral circulation. I'm going to break it down in a simple, easy way so you understand exactly what's happening inside of the arteries. So there's two steps that happens. There's the first step where plaque builds up inside of the arteries. Everything begins with this step where there's injury inside of the artery walls. This damage can happen from high blood pressure, high cholesterol, smoking, diabetes, pretty much anything that irritates the lining of the arteries. Once the inside layer is damaged, fats and cholesterol can start sticking to it. Okay, and step two, this is where the plaque is built up. Fatty deposits start collecting inside of the artery. Over time, they thicken and narrow the vessels. The yellow buildup in the artery represents plaque blocking blood flow. And I'll insert a picture right here. Risk factors are high cholesterol, high blood sugars, high blood pressure, and also lifestyle factors that just affect like your day-to-day basis. So even though plaque is forming and narrowing the artery, the heart actually has a backup plan that brings us to the next section. Okay, the next section is collateral circulation. With collateral circulation, it's the heart's natural protective response. This is when the artery becomes slow and it's blocked. But even though the plaque is forming and narrowing the artery, the heart actually has a backup plan that brings us to the next selection. Okay, collateral circulation. This is the heart's natural protective response. When an artery becomes slowly blocked, the heart begins forming small new blood vessels around the blockage, like building a well-detoured road. These vessels maintain blood flow to the heart muscle. Even with new vessels, blood flow can still be reduced, especially if plaque becomes large or blocks the artery suddenly. That's why early prevention and understanding risk factors are crucial.
Now we're going to talk about the risk factors for coronary artery disease, starting off with the ones that you can't change, so the non-modifiable risk factors. We have age. As we get older, the arteries naturally stiffen and plaque builds up, increasing risk. Family history. If parents or siblings had early heart disease, your risk also goes up. Gender. Men typically develop coronary artery disease earlier, and women catch up after menopause due to hormone changes. Genetics. Some people inherit cholesterol disorders or other traits that increase risk. And for the modifiable risk factors, the ones that you can change is smoking. So smoking damages blood vessels, increases inflammation, and speeds up plaque buildup. High cholesterol, too much LDL or bad cholesterol leads to plaque in the arteries. Hypertension, high pressure is more damage to the artery walls. Obesity, the extra weight increases cholesterol, blood pressure, and diabetes risk. Physical inactivity, a sedentary lifestyle is also a higher risk. Poor diet, too much sugar, salt, or saturated fat increases your risk. And then diabetes, high blood pressure damages the blood vessels. Also stress, chronic stress can raise blood pressure and trigger unhealthy habits.
Angina happens when the heart needs more oxygen than what it's getting. Types of angina include stable, unstable, and Prinzmetal's angina. Stable angina is a predictable, temporary decrease of oxygen to the heart, usually due to coronary artery narrowing from the atherosclerosis. Why does this happen? The coronary arteries are partially blocked from the plaque, but not suddenly. When the heart works harder, it needs more oxygen, but it's not getting enough. Typical triggers is physical activity, cold weather, stress, smoking, and big meals. The pain pattern for stable angina is like heaviness or pressure, like an elephant sitting on your chest. The pain usually lasts 20 or less minutes, and it can go away with rest or nitroglycerin. Next is unstable angina. So this is a new, worsening, unpredictable chest pain caused by ruptured plaque. Because the plaque is ruptured, the platelets are going to form a clot, which in return reduces blood flow. So why does this happen? So the plaque inside the artery ruptures, platelets form a clot, and then the blood flow becomes severely restricted. This is a medical emergency because if this progresses, it can cause myocardial infarction, or for short, MI. The pain pattern for unstable angina is when the chest pain is lasting more than 20 minutes. Nitroglycerin may not help relieve, and then the pain can also radiate to the jaw, the arm, or the back, and it's usually accompanied by shortness of breath, nausea, or sweating. So now let's talk about Prinzmetal angina. This is when the chest pain is caused by temporary spasm of the coronary artery. This is not caused by plaque. The artery clamps down, cutting off oxygen supply. So why does it happen? This happens because of vasospasm, smooth muscles contracting. It's not always related to exertion, and it can also happen to normal coronary arteries. Some of the triggers can be from cold exposure, stress, smoking, drug use such as cocaine or methamphetamine. It sometimes occurs during rest or sleep. The pain patterns for Prinzmetal angina is the pain happening during rest, usually occurs in cycles, and the ST transient is elevated on the ECG because artery spasms are shutting off blood flow briefly.
Waking up with chest pressure and short breath? Don't panic. It might be angina. Angina begins when the heart is working harder than the arteries can keep up with, asking for more oxygen than they can deliver. Imagine a traffic jam inside your arteries. Oxygen demand is high, oxygen supply is low. That's the real problem. Angina usually feels like pressure, tightness, squeezing, or burning in the center of the chest. The discomfort can move to the left arm, jaw, neck, or back. That's called radiation. But not everyone feels angina the same way. Some patients may notice atypical symptoms like fatigue, nausea, shortness of breath, dizziness instead of classic chest pain. When does the heart begin to struggle? Intense exercise, emotional stress, heavy meals, or exposure to cold? All of these increase the heart's workload and can provoke angina symptoms. Your action plan: 1. Stop and rest. 2. Take nitroglycerin as directed. 3. If pain lasts over 5 minutes, call for emergency help. You're not alone. Talk to your doctor. They'll help you manage it and keep your heart happy. Angina is common and not a heart attack, but it can signal risk if ignored. Many people manage angina with medication and lifestyle changes, and stress control make all the difference. Recognize symptoms early to stay active and safe. The sooner you act, the safer your heart stays. Thank you for watching this video. Bye.
There are multiple diagnostic tests used for coronary artery disease. However, the most common ones include the electrocardiogram, or the ECG. And this is, what it does is it records the electrical activity of the heart. It can also show signs of past heart attack or abnormal rhythms. We also have the exercise stress test. So for this test, you would go on a treadmill and you would walk or run while we monitor the ECG and symptoms. If your heart doesn't get enough blood during exercise, the ECG shows changes. We also have the echocardiogram, which is an ultrasound of the heart. It shows while the heart is pumping and whether any part of the heart muscle isn't moving normally, which is something that can happen when an artery is blocked. We also have the coronary CT angiography. So it is a special CT scan with a contrast dye, and it gives detailed pictures of the coronary arteries and shows plaque, narrowing, and calcium. We also have the coronary angiography, which is a thin tube gets threaded through an artery, usually the wrist, and it goes up to the heart. Afterwards, dye is injected, and then you are able to see the arteries on an x-ray.
Let's talk about the medical treatment for coronary artery disease. Diet therapy. It consists in lowering your sodium, lowering saturated fats, and eating more fruits, vegetables, and fiber. We have nitrates. They work by opening up your blood vessels. It's like opening a window to get some air. We have beta blockers. They relax the heart. So it's like giving your heart a little spa day. Calcium channel blockers. They widen and relax the arteries. So this time the arteries are having a spa day. We have antiplatelet therapy. It prevents things from clotting. It's like preventing things from turning into a group project. ACE inhibitors, they lower your blood pressure and protect the heart over time. Statins, they lower your cholesterol. It's like the organized roommate that cleans everything. Risk modification factors, it consists in increasing your exercise, quit smoking, managing stress, blood pressure, and diabetes. For the surgical interventions, we have PCI. Angioplasty, it's a tiny balloon that gently opens the artery. And we have stent placement, a little metal piece that keeps the artery from closing. Atherectomy, it's a tiny device that scrapes the walls of the artery to remove the plaque. All of these treatments work together to improve blood flow and protect the heart.
What is the main reason for coronary artery disease? Anybody?
Why does the patient show fewer symptoms of chest pain during physical activity?
How does diabetes accelerate the development of coronary artery disease?
Described by chest tightness, the radius to the arm during exercise and goes away with rest.
If we need to lower the blood pressure of a patient by widening the arteries, what medication would you choose? A calcium channel blocker or a beta blocker?